And now moving a little away from the microbiome and to more pet owner related questions. So
Mhm.
just to give our listeners an overview again, what's the difference specifically between a dermatitis and allergies?
Yeah, it's a good question. Dermatitis is a fairly general term and it refers to skin inflammation. And it's a common condition that we see in pets, and it often will result in an itchy, dry skin or even a rash that might develop. But dermatitis is actually caused by self-inflicted trauma from a pet that's licking or scratching the skin, secondary to allergic itch. Bacterial or fungal skin infections might be present. And we often see allergies can result from environmental or food allergies.
Hmm. And what causes these allergies?
So that's a more complicated question. Dogs can develop both food as well as inhalant or environmental allergies. Allergies overall are a damaging immune response that occurs in the body when a substance is present that our body reacts to. And one of these presentations that we see in dogs is a condition called atopic dermatitis. And it's actually a hereditary condition that results in itchy and inflamed skin issues. And it can be associated with a protein in the body or an immunoglobulin called IgE. And it's the part of the immune system will actually target environmental allergies such as grasses and trees, weeds, house dust mites, or storage mites. And atopic dermatitis tends to occur in dogs between the age of 6 months to 3 years. And the dogs will develop itching as well as secondary skin lesions that can be present around their face and their ear pinna, their ventral abdomen, their extremities, their paws, their groin area. Whereas food allergy is a less common condition and it can occur in dogs and cats of any age. And it tends to be a more continuous itch. So clients will often report that there's not a seasonal association. And in animals, we tend to see food allergy result more from a protein source rather than a carbohydrate. And a lot of food allergy patients will also have gastrointestinal issues as well as skin problems.
Oh, wow. Yeah, that's a lot to consider for a pet owner. And obviously, they should take their pet to the veterinarian right away when they see any lesions or anything like that. But if there's nothing too obvious that would alert a pet owner, how often do pet parents should take how often should pet parents take their dogs to the vet for a health checkup?
So dogs that are under 7 years of age, depending if they're a large breed or a small breed, because some larger breeds are considered seniors more at 4 to 5 years of age. But normally you want to have your dog seen once a year. But as they approach more of a senior age or over 7, they really should be seen every 6 months because their routine examination is really important to identify problems early and make sure that they're staying current on routine vaccinations, annual fecal testing, and just blood work to monitor their overall systemic health.
Mhm. And going to the pet store, you see all these aisles full of shampoos, body sprays, lotions, so many different brands, so many different options to buy from. Do you have any recommendations? Is there anything that pet parents can look for the ingredients or what kind they should get for their pet?
Yeah, there's definitely a lot of options. Like you mentioned, there's going to be cream rinses and sprays and mousses and lotions and wipes and
Yeah, it's a little
they're
overwhelming, right?
yeah, certainly, and they're not all created equal. I definitely recommend implementing topical therapy with my patients because it helps remove allergens and decrease itch, and it can decrease secondary bacterial and yeast infections. Um, I personally prefer medicated baths when an owner is willing to bathe their pet because I think it can provide the most coverage to a patient. But it's also not always possible, and sometimes the wipes and the mousses can be a little bit easier, and it can allow more compliance to be able to do treatments more frequently. But I think it's important to purchase the ingredients that are going to provide the right function for their condition, because some of these products are moisturizing and some are going to provide antibacterial or antifungal properties, or they're going to treat scaling conditions or something called antiseborrheic properties, where they can remove that dandruff or scale that patients can develop. And we also see skin barrier defects in patients where they have a condition called transepidermal water loss. And this can often result in dry skin where pathogens can overgrow and they can enter the damaged skin. So there's going to be products available that have ingredients like ceramides and phytosphingosine or oatmeal, and those can be very hydrating to the skin to reduce inflammation. And then there's other products that are antiseptic or antifungal. And we tend to prescribe these more to patients that have secondary infections to kind of decrease that pathogen overload so that we can avoid systemic medications. I usually caution owners from utilizing any products with benzoyl peroxide because they tend to be very drying to the skin for most patients. There are some newer generation topical therapies that are being developed without antiseptic properties, so it helps work with and support the microbiome to contribute to a healthy skin barrier. And I think that's where we're going to see a lot of our products moving in the future.
Oh, that's great that the microbiome is even being considered by these companies now that they actually need to pay attention to it. That's all very fascinating. But now, if a pet parent sees any skin issues with their pet, how long do you think they should monitor it? What should they pay special attention to? What kind of questions will their vet ask them that they should already plan ahead for?
That's a good question. There can be a lot of signs that can indicate a pet has an allergy or infection. Normally, they'll see a pet licking or chewing or scratching, and those can all be an indication that the pet is itching. Often, they'll develop hair loss or they might have a skin odor, and that can be associated with infection. And with chronic conditions, the skin often will become darkened or red, and the pet may have frequent problems with their ears and their anal glands, which can also be secondary allergy or infection. So it's best to have the pet seen sooner by a veterinarian so that they can start treatment early. And it tends to result in a more mild infection and a less complicated treatment. But we also have to keep in mind that some of these infections, as we discussed earlier with the multi-drug resistant infections we're seeing, can be contagious to humans. So it really is in everyone's best interest that a pet's diagnosed quickly and that the skin itching is controlled early so that we don't develop problems that could be an issue for everyone in the house.
Oh, yeah, certainly. But I think there's some uh, dog breeds that are more prone to these allergies, right? Or some of these dermatitis. Which breeds do you think are more susceptible to this?
Oh, yeah, absolutely. We definitely see breeds quite frequently in dermatology practice, including bulldogs and retriever breeds, as well as poodles and all of the different poodle hybrids that exist now, and Shih Tzus, Cocker Spaniels. They tend to be more genetically predisposed to allergies, but really allergies can develop in any dog. We also can see genetic skin diseases in a lot of different dog breeds. And some dogs are predisposed because of the anatomy of their skin structure or the way they have numerous skin folds present. And that's obviously a big issue in bulldog breeds. There's a big difference between skin disorders in dogs that are curable versus we also have this subset of skin conditions that are not curable. And I always tell clients there are hereditary disorders of the skin that are not curable. And we unfortunately do see canine genetic skin disease. There can be things like ichthyosis or skin fragility syndrome. That's also associated with Ehlers-Danlos syndrome. And in puppies, we can even see puppy strangles or a juvenile cellulitis that can be due to a hereditary issue with the immune system. Or we can see autoimmune skin diseases, like I mentioned earlier in the Chihuahua patient that developed pemphigus, where the dog's immune system is targeting its own tissues and causing destruction. And some of these conditions, unfortunately, when there's a hereditary component or an immune system issue, are really going to require long-term supportive care, including topical therapy, as well as supplements and medication. And it can be frustrating for a pet owner.
Oh, yeah. Is there anything that you can do to prevent dermatitis and these allergies?
Unfortunately, there's no way to completely prevent your dog from developing allergies. It's often a issue where we have to use several different treatments for management. And if we do see that there's the genetic predisposition to allergies, such as atopic dermatitis, we can prescribe a hyposensitization therapy. And this is where we will actually perform allergy testing through either intradermal skin testing, or we can pull a blood sample and perform a serology test. And what we do with that information is we generate a report of the allergens that patients are testing positive against so that we can provide a desensitization therapy and help retrain the immune system not to overreact to exposure to these allergens through allergy shots. So essentially, with time, 2 to 3 years of immunotherapy that's specific to the allergens that a pet is reacting to, a lot of pets, I would say about 2/3 of dogs that go through the treatment can desensitize, and maybe 50% of cats, which can really decrease the amount of secondary infections that they develop. And during that time, I also recommend we use routine topical therapy to remove the allergens, support the pet with oral supplementation of omega-3 fatty acids, and do all we can to support the skin barrier. Early intervention with probiotics, those can all be valuable treatments.
Mhm. Another tip for our pet parents, if you can tell pet owners one thing to really do to improve your dog's skin health, what would that be?
I think flea control is the big thing I always tell clients to rule out first. We really recommend that all pets in a household should be on consistent flea prevention. And it's really important to rule out parasites before you start looking for other causes of itchy skin, such as a food or environmental allergy, because they're quite common.
Mm-hmm. Keyword food. So there are so many pet probiotics now, just like the human world, the pet probiotics kind of exploded. There's so many different options, so many different strains, so many cocktails of bacteria. How do you even see through all that? Where do you start? Which ones should you take? Is there any ones you should avoid? Do you have any recommendations for us on that?
Yeah, well, it's a big market for sure. I, take probiotics personally. I feed them to my own pets. I think it's important to provide these beneficial bacteria strains for a healthy intestinal tract, but I also think that they suppress the growth of the pathogenic bacteria. I think treating patients to control gastrointestinal symptoms like diarrhea can be valuable. We've seen some recent published studies that show that if you give probiotics to pregnant dogs or young animals, it will actually decrease allergies throughout their life, which is really interesting. And we also know that certain strains of probiotics, like the Phytobacterium, can improve the mood of patients, which is really interesting research that is, being done. And it's kind of a well-known fact that we have more of these microorganisms in our bodies and that of our pets compared to our own cells that we have. So it just makes sense that when you have dysbiosis, it's going to affect our mood as well as alter our health. So avoiding kind of recurrent antibiotic therapy will support a good, normal gastrointestinal flora. And I often have or clients ask if they can give yogurt to their pets. And I really advocate against this because it's usually not a strong enough concentration to repopulate the intestinal tract of a pet. And it's not always the correct species or strain of bacteria to support the gastrointestinal tract of dogs and cats. So there really are some veterinary specific probiotic strains that are designed for pets that will really do a wonderful job colonizing their intestinal tract. And there's a lot of available products out there. I think it's best to consult with your veterinarian.
Mm-hmm. So these probiotics are the bacteria we're feeding, but then there's also prebiotics. It sounds almost the same, but it's a completely different thing, right?
Yeah, prebiotics are actually soluble fibers, and they're a type of carbohydrate. They're called oligosaccharides. And what we see is if you feed them at high levels, they can decrease the fecal protein digestibility. So it kind of helps us ferment the food that we ingest faster and maintain a normal bowel movement. But we're seeing that if we supplement prebiotics in a diet, it's going to help improve an animal's performance, their digestion. Often they gain weight better and they have better food efficiency, which is a big thing in food animal medicine too.
Mm-hmm. We are what we eat, huh? That applies for our pets as well, it seems.
Yeah, oh, absolutely.
But I wanted to get back to, you mentioned now a few times the overuse of antibiotics, and it can be quite scary how we have these antibiotic resistant strains either in humans or in pets, and we can actually give them back and forth between other household members. And the overuse of antibiotics is becoming a more and more apparent issue in human and animal treatments. What are your thoughts on how we should address this issue?
It's why, as a medical profession, we're trying not to over prescribe antibiotics for not only skin infections but also respiratory infections or gastrointestinal infections, because we're seeing that if we prescribe too many antibiotics or they're taken too frequently, animals are developing, as well as people, we develop these inappropriate or pathogenic strains of bacteria. But we're also seeing that our antibiotics are just not working against them anymore. And even our most powerful antibiotics might not treat an infection, which is really scary. It's a big global problem, and I think it's a good example of why we need better diagnostic testing, like what your company is doing with my dog, so that we're selecting the correct antibiotic every time our patients have an infection.
Mm-hmm. So you sound like you're quite concerned about the overprescription of antibiotics. How about antifungal prescriptions too? You don't hear so much about that in the news as of yet, right?
Yeah, I mean, I think that we're certainly seeing some studies emerging where we are seeing some fungal resistance. We're certainly seeing imbalance of fungal organisms. I know I mentioned earlier malassezia on the skin of dogs. We're certainly seeing thrush and um, infections in humans that can lead to more frequent problems where they're developing dysbiosis. So unfortunately, I think that it can be an imbalance of both fungal and bacterial issues that can be a big problem as a medical community. So decreasing the amount of antifungal treatments can be important too, and doing more topical therapy and probiotics, I think, can support patients.
Mm-hmm. So moving away from the microbiome a little bit, what are the open questions you'd like to see addressed in your field?
Yeah, it's a good question.
Could be anything. What can you think of?
I think right now what we're seeing is that client communication, especially for what I'm doing in veterinary dermatology, is really important because we're kind of entering this age of technology where owners and pet owners are often going to Dr. Google before they seek out medical advice with a veterinarian. So we're really trying to see how we can best incorporate telemedicine into our field, and it's challenging with what we do because we perform a lot of diagnostic testing on our patients in, using things like, you know, cytology and cultures and different NGS type sequencing testing. It's nice for us to have a patient in front of us. But telemedicine does allow us a consult point with a client so that we can help monitor a condition or at least make sure it's responding to the prescribed treatment. Because with what we see is our clients often become frustrated because there's not a quick fix or a cure for a lot of the conditions that we're treating. And if we can check in with a client and make sure that the treatment is going well and that they're seeing positive results, often they'll stay with the treatment plan because we're really dependent on client compliance for our pets to get better. And I think telemedicine could be a really valuable tool for our profession in the future.
Hmm. And if you had, let's say, maybe $10 million and you could do whatever study you could, would you maybe increase more telemedicine, or what would you do with the money if it could be anything? Let's say $10 million so you can do whatever you
Yeah, well,
like.
$10 million is a lot of money.
Hmm.
I
Is
think
that
I'd like
enough,
to
or do you
see,
want 100 million?
yeah, I'll take as much as you're willing to give me, but I think what I'll do is I would probably support more of these comparative dermatology and oncology programs. There's a lot of studies that are not only looking at the skin, but they're also looking at the brain and looking at things like lung and bone cancer in pet dogs. And they're using dogs as a study model for studying cancers in humans, because dogs and humans share the same environment. But what we're seeing is that dogs can develop cancer quicker, and it can shorten their life expectancy a lot sooner than in a human. But unfortunately, the treatment options for dogs have really lagged behind what's available for human therapies. So when I see patients or dogs that are diagnosed with cutaneous lymphoma, for instance, it tends to be a very poor prognosis. And a lot of these dogs are euthanized or put to sleep because it's a very progressive disease. But there's a lot of research that's being done around lymphoma, and they're looking at metabolic changes as well as tumor DNA markers, because we're seeing a lot of human lymphoma cases as well. And a lot of the cancer treatments that are safe and effective in dogs are also going to work on people. So I think pet dogs can be a really good model for studying human cancers, so we can develop better treatments for both humans and animals. And we're seeing so many novel therapies coming out right now with the development of monoclonal antibody treatments, and a lot of these treatments are becoming available for dogs with lymphoma, which is really exciting.
Hmm. Yeah, yeah, that sounds like a great field of research. But besides that, what other new innovations would you like to see in the field of animal health?
I think nutrition is probably one of the most interesting areas that we're seeing in human health. I think if we can optimize pet food, not just for pet, dogs and cats, but also for food animals, it can really improve the quality of life of these animals. And if we can do microbiome sequencing and supplement the areas where they have deficiencies in the gut, we can provide appropriate probiotics. And I think that can really impact the food that we're giving animals in the future. I think understanding the different microbiota species are important for us to make really good dietary recommendations. And I think as these technologies continue to advance, we're going to see an improvement in global farming, which will benefit our food supply as a world.
Yeah, and global farming also has such a big impact on our overuse of antibiotics. So all that is highly related. Yeah.
Absolutely. I mean, yeah, unfortunately, we know that food animal is a big part of, if we're treating these feed animals with antibiotics, we're eventually consuming and digesting those antibiotics, and it's causing changes in overall antibiotic resistance problem.
Yeah, yeah, really important issues. If you could see 200 years into the future, how would you imagine animal medicine will be like?
200 years is a long time for sure. um, I think what we're really going to see that's going to be a big change as the years go by is more gene therapy advancements. And I think we're eventually going to see animals that are disease resistant. Biotech and genetic research has been improving so rapidly. I think that seeing more immune system research at a genetic level with different species is going to be inevitable. And we're going to see more development of vaccinations, more genetic research that's progressing. And hopefully we'll be able to eliminate a lot of these genetic diseases in both animals as well as humans, so everyone can be healthier in the future.
Mhm. And as we are wrapping it up here from the future to the past, if you could, what would you tell your younger self starting out in the veterinary profession? Any tips you could share?
It's a good question. I mean, veterinary medicine is a really rewarding profession, and I think it's the right path for me personally. But I always tell students that work with me that being a veterinarian, it's not just a career, but it's a lifestyle. And I often take my work home with me, and I'm constantly thinking about my challenging cases. But I think it's really important to not stop learning. I don't think the end goal should be obtaining a degree, but it should be the mentorship of those that you work with, your colleagues, and people that are within your circle, because you're always expanding your knowledge. And I think that's really important in the veterinary profession or any of these medical professions because things are changing so quickly.
Mhm. Yeah, that's great advice. So, is there anything else you'd like to share with us today? This is my last question for you, I promise.
um, I think veterinary dermatology is a great specialty option for your pet. I think starting with your general practitioner is fantastic, but when conditions become frustrating and your pet's developing recurrent, frequent infections and they're itchy and they have ear issues and skin issues or anal gland issues, I think it's really important to seek out a veterinary dermatologist to hopefully get to the bottom of their problems quicker and to decrease your own frustration. So it can be a really important part of your pet's treatment plan to seek out specialty care.
Mhm. That's good advice. Well, then, thank you so much, Alissa, for taking the time to chat with us today. So many important tips and such good advice for young pet parents out there. And we hope to hear again from you soon.
Thanks for having me. Have a great day.
Thank you. You too.